This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, I'm coming to you from the W.L. Nugent Cancer Center at KRMC. My guest is Dr. Shirnett Williamson. She's a board-certified radiation oncologist. Dr. Williamson, welcome to the program.
Thank you for having me.
Thank you. Thank you for having me. I want to welcome you to KRMC. I know you've been working here for a little bit.
Yes.
You were working in a locums capacity, right?
I was, yes.
So that was May of 2025.
May of 2000, yes, that's correct.
So for listeners who don't know, the locums position is like trying to fill a need.
That's right. It's a traveling position. Mm-hmm. So usually you're recruited to go to different facilities, usually where there's a need, just as a traveler. And it's basically not a permanent position, but just a temporary position to fill in.
And for doctors who are maybe trying to figure out where they want to settle or just sort of like a nomadic lifestyle, locums it's an endless adventure, right?
That's exactly right. And especially gives you an idea to travel around the country, see different places, and just to enjoy it as you go along.
Yeah. So that's an interesting gig, but something must have happened along the way that led you to say, because now you've accepted a permanent position here.
That's right.
What was that?
I came to Kingman and I did not at all think I was going to be accepting a permanent position. Mm-hmm. I've actually been a radiation oncologist for 30 years and I thought I retired. However, when I came to Kingman, there was such a great need. I came into the facility. The staff was just amazing. I felt at home. It reminded me of the facility where I actually had left. And also the patients were just amazing. I mean, I went into so many rooms meeting with so many patients who asked me to stay and be their doctor. And after too many people have told you the same thing over and over again, then you start to listen. And so my husband, who comes with me each time when I did locums, we had the conversation, what do you think about me staying? And he agreed with me that I think you need to stay. I think this is your calling and I think you need to be here.
So is it possible that the patients guilted you into it?
I think they had something to do with it as well.
Yeah.
But I just realized that what else am I doing anyways? I mean, I was certainly just going to be traveling and doing the same thing. Mm-hmm. So there's no reason why I can't just stay here and be here and be a permanent physician because, they really needed this doctor here.
We have talked about this a few times on the show, but Mohave County is the 5th largest county in the contiguous United States.
Okay.
It is huge. It is bigger than some states.
Yes.
And so that makes KRMC an outpost.
Okay.
There is a whole lot of rural area out there. Have you explored the desert much?
Yes. My husband and I, we've been driving around and it's actually amazing and beautiful. Yeah. It's new to us, so we have so much more exploring to do. Yeah. But we've certainly been enjoying it. And actually that's part of our, why we like Kingman. It's just really a neat town. We go up into the mountains for hikes. It's just so peaceful and calm. The people are also so really nice. Mm-hmm. So that's been a great attraction for us. And not to mention the weather. I mean, if I was in the East Coast, I would have had so much snow, and now I have 70-degree weather today.
I came from the wilds of New York State, where my sister still is and is digging herself out.
Right.
And I feel kind of bad. Spring training is going on out here. So,
That's
no,
right.
Actually, I don't feel that bad. KRMC is a bit of an outpost, just to return to that idea.
Yes.
And so you're serving patients who come certainly from the Kingman area, but I'm guessing from all throughout Mohave County and maybe even beyond.
Yes, I see so many patients who are driving. I remember the one gentleman who said he was driving 100 miles round trip to come each day for radiation treatment. And I've never experienced that before. Yeah. But you're absolutely correct. This is the only place where they're able to come. So it's a privilege for me, honestly, to be able to provide that care for these patients who really need it, and they have to travel so far to get it.
Yeah. Well, you mentioned 30 years in radiation oncology, and I want to tell you thought you had retired, but surprise, you didn't. I want to talk about your resume because I'm looking at it, and it looks like you've had one adventure after another in medicine and in different parts of the world.
So, yes, you're absolutely correct. My life has been all over the world.
So this theme of sort of have stethoscope will travel, right?
That's right.
You did an internship in internal medicine. You had residency training in radiation oncology at Thomas Jefferson Hospital, a decade of practice in New Jersey.
Yeah, so the University of Pennsylvania had a satellite facility in New Jersey. And so as they hired me right out of residency to be a radiation oncologist at this facility. It was called Mercer Medical Center at the time. So I worked there for 10 years. Then I saw the opportunity to go to the U.S. Virgin Islands to set up a cancer center. They were recruiting a radiation oncologist there. So I went to the U.S. Virgin Islands. It was an amazing opportunity. You know, we built this cancer center from the bottom up. I mean, I was going to meetings with construction workers, talking about how to do the vault, where things needed to go. And so it was a phenomenal experience. So I was there for 3 years, but then I got recruited back by University of Pennsylvania and also the satellite facility, which was Mercer Medical Center at the time. And then I ended up staying for the satellite facility, and they changed their name to Capitol Health Medical Center. So I stayed there as the medical director of radiation oncology.
New Jersey, Pennsylvania is probably like Miami of Ohio. It always confuses people and requires a little clarification. So thank you for fixing that for me.
Yes, they were both next to each other. So yes, I actually lived in Pennsylvania and worked in New Jersey just because it's so close.
Right. I got you. When you took that opportunity to go to the U.S. Virgin Islands, did it, I mean, because you had established a practice and you had experience before that, did it feel like kind of jumping into the void? Was it a little bit scary to do?
It was not actually, because you're absolutely right. Having the experience, then it wasn't difficult. What the difficult part of it was educating patients to let them know that we're here. This is what we do. We're here for you, because these patients were used to traveling. They had to go to Puerto Rico or they had to come to the mainland for radiation treatments since it wasn't available to them. So it was educating them, letting them know you actually have quality treatment here. You know, this is just like these other places. So we were on TV, we were on the radio, we were writing newspaper articles, we were going to churches, we were everywhere, educating them, letting them know what this was all about, what this technology was. And then we were doing all the things that cancer centers do, screening, providing research, doing multidisciplinary conferences, doing everything. So, you know, really building all of that is basically what I was involved in. But it was a phenomenal experience.
So if they hadn't had those facilities for a long time, then they finally got them. Was there kind of a suspicion among the locals, like, oh, if we have it, it must not be very good?
Exactly. That's exactly right. Yeah. Yes.
So, I mean, not only did you have to put together great facilities and a great team, you also had to win hearts and minds.
That's right. That's right. But it was great.
Yeah. Dr. Williamson, when you look back on your education and the sort of the formative years in your career, what led you in particular into radiation oncology?
When I was in medical school, I had 2 family members with cancer. Actually, my grandmother had colon cancer. My father developed multiple myeloma. And throughout, you know, I thought I was going to be a pediatrician and then I was going to be an OBGYN doctor. But then when I discovered radiation oncology, I realized that I was a perfect fit for that. I realized that I liked radiation oncologists. They were nice people. And the question of what do you want to be when you grow up? That's what I wanted to be, a nice person when I grew up, taking care,
right? Yeah.
taking care of patients. But also my background, I did anatomy. I also did pure and applied sciences, and I did math and computer science in college. So it was all a scientific background, using physics, chemistry, and so forth. And so physics is used a lot in radiation oncology, as along with computer science. So I felt that these would have been ideal in that field. And yes, it's really been a great fit for me, and I've enjoyed it ever since.
It sounds like it was character first, or foremost, having something you could believe in and then applying the science.
That's right.
Right?
That's right.
I've heard that from pediatricians, by the way. I have one close to me. So for listeners who are unfamiliar with the field of radiation oncology, let's talk a little bit about what you do. What's a day in your life like around here?
Sure. So what the field of radiation oncology entails, it's where we're using X-rays to treat patients with cancer. So just like when a patient would come in and they have, for example, a chest x-ray, we're doing the same thing using this large machine. However, we're laying patients on this machine and we're directing x-ray beams to the area where the cancer is located. And usually we're giving a really high dose, and the whole goal of this is to kill the cancer. So a typical day when a patient comes in might be that I see patients in consultation. So I speak to them about their diagnosis of cancer. I let them know if they qualify for treatment, what the treatment would entail, the side effects of treatment, and then we would then develop a treatment plan for them. Most patients, before starting their treatments, they come in to have a CAT scan where we localize the area for treatment. So it's basically a CAT scan through the area. Then that goes into our computer. I spend a lot of time on the computer outlining the areas where the cancers are. I also outline the normal structures around it, because when we're giving radiation, we need to make sure that we're giving high doses to cancers, but not treating the areas surrounding them. So for example, a lung cancer patient, if we treat too much of their lung, then we could cause scarring of their lung. We could cause them to have pneumonias, all sorts of things. So we need to minimize all those other areas and come up with treatment plans to give the tumor what it should have, but minimize side effects to other areas. And so patients will come in, they're getting their treatments. I check their films, making sure that the treatment plan is the way it should be. I also will see patients afterwards to make sure that they don't have side effects from the treatment. So it's a lot of things, and a lot of things behind the scenes that you're not seeing or the patients are not seeing.
Yeah.
And it's a whole team, just to let you know, we're working with our radiation therapists who actually administer the radiation. We're working with our physicists, our dosimetrists who are doing the actual planning. So a whole team is involved. And our nurses, of course.
Nurses, of course. Nurses move the world. We all know that.
Absolutely.
In 30 years of practice in this field, how has the technology changed?
It's changed enormously. So when I started off, we would have 2D radiation, which means we would take films, just an X-ray film. I would be standing, drawing on the X-ray film where the tumor is. Now we have CAT scans where we're doing this in 3D, but we actually have come to 4D, meaning that not only are we doing CAT scans, but we're taking motion into consideration. So let's say we're treating a lung cancer and the patient's breathing. We're taking that into consideration as well, because if you're breathing, your tumor may move. And so we're actually drawing on scans, drawing where the tumor is, so that's not moving. So so we're treating tumors and not missing them. The other thing is things are so much more targeted, so they're just more pinpoint. And that's really good because we can give higher doses, but at the same time, also less side effects. Patients are living longer. They're not having as many side effects. So it's incredible watching this field and seeing how far it has come.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Dr. Shirnett Williamson. She's a board-certified radiation oncologist, and she's pretty new here at the W.L. Nugent Cancer Center at KRMC. Dr. Williamson, a moment ago, you alluded to the collaborative nature, the fact that patients come in and they're working with entire teams of nurses and physicians. I want to focus on that a little bit more and ask about specifically how the multidisciplinary approach ensures that patients get the best care.
Absolutely. So when patients, before they're treated, all their treatments are based on research that have been done before. We follow standard of care, meaning that we don't treat patients unless we know that whatever we're giving them, whatever we're using has been proven over and over, and we know that it's going to be of benefit to them and it won't harm them. So let's say a patient comes in, they think they have cancer. We're going to first have made a diagnosis. So maybe patients would have just had like a biopsy. We have a diagnosis of cancer. Then a lot of times a surgeon will be involved, a medical oncologist who gives chemotherapy will be involved, a radiation oncologist. And so all three specialties will know what we're supposed to be doing for that patient in order to get them the appropriate care. So most times it may be that they have surgery first, then they have chemotherapy or radiation, or it might just be that, no, they don't need surgery. It's just chemotherapy and radiation or radiation. But all these standards have been established, and so we all follow them. As a matter of fact, there's something called NCCN guidelines that we now all follow. There are guidelines that are updated as new studies come around, and so they're continuously being updated. We all are able to see them, and so we all talk to each other. So, when a patient comes in, I might be going to the medical oncologist's office or calling him and say, hey, this is what I'm going to do. You're going to do chemo. I'm going to do radiation. This is when we're going to start, so on and so forth. So it's a collaborative effort, and it's like a constant working together to make sure we're following the standards and doing the right things for the patients.
You just described the process of collaboration. Is that tumor board, or is that a more informal version of that?
That's more informal, but we also do tumor boards.
Yeah,
and tumor
what is
boards.
that?
Yeah, so that's the formal version where we all meet together. We meet with everybody who's involved with the patient's care. So the pathologist, the radiologist, the medical oncologist, surgeon, radiation oncologist, and other supportive members as well. And we will discuss cases. So for example, if a doctor has a case that they would like to discuss to get input from all the other members of the team, or maybe it's just to go over their films or pathology for clarification, then we'll do that. So let's say I have a patient to discuss, and I would present the history of that patient. Then the radiologist would show the films. The pathologist would discuss the pathology. If the surgeon has any input or if they were involved, the medical oncologist, and we all talk about the patient. So we, leave knowing what the appropriate care is going to be for that patient. But we also have supportive members of the team. For example, we always evaluate each patient to see if there are any research protocols that they may need or may be available for them, or also things like if they need a social worker, if they need to be referred to physical therapy, if there's any other needs they may have, then we also discuss that as well, and we make a final plan for that patient.
In January, the W.L. Nugent Cancer Center earned national accreditation from the American College of Surgeons Commission on Cancer. This is a consortium of professional organizations dedicated to improving survival and quality of life for patients with cancer by setting and raising the standards. And KRMC is one of only 4 programs in all of Arizona accredited by the Commission on Cancer. What can you say, Dr. Williamson, about this? Tell me a little bit about the accreditation.
It's a big deal, and I think the community should be proud that KRMC does have this accreditation, because it means that we're held to high standards that we are doing for our patients. And a patient can feel comfortable coming in knowing that they're getting the best care, because not only are we adhering to what else is required throughout the country, but also knowing that right in their backyard, it's right here. As a matter of fact, the facility that I came from also had this accreditation. So that was actually another thing for me that was important.
A selling point, right?
Absolutely, because I want to work at a place where I know there's a standard that we're adhering to, also that we know we're offering excellent care to patients. So that's all important. And, by having this type of accreditation, it's not only cancer treatments, but it's looking at the whole spectrum of cancer. So they are holding you accountable to doing things for cancer prevention, for treatment, research, education, all the entire spectrum. And then they monitor you to make sure you're doing all of these things. Yeah. So that way you'll be able to offer excellent care for the patients in the community.
In addition to your work in patient care, you've also served as an instructor and clinical professor for medical students and residents. What are some of the core lessons you want to share with the next generation of doctors?
I would say just remember you are of service to other people. Put them first. You will find that at the end of all of this, it's completely worth it. It's amazing to be called 20 years later by a patient that you didn't even remember, who said, "Thank you for saving my life so that I could see my grandchildren." What a feeling for somebody to say that to you. So it's completely worth it, even though you're going through schooling and it might seem really hard at the time. Just enjoy it and just go with it. You'll find that it goes by quickly. Another thing to remember is also take care of yourself while you're going through all of this, and remember your family as well. Don't just seclude yourself, because that can happen too. So just remember all of those things are important, and live life to its fullest.
So it's lovely advice, and thank you for sharing that. And I have to say, I've asked that question or something similar of many doctors, and it's interesting to me, no one has answered anything about what this technical thing or this thing about dealing with insurance companies, which we know can be a headache.
Right.
Every physician, every single one has told me, I think for them, they're intelligent folks. They can learn the technical side.
Right.
But there's this human side that has to come first.
Oh, absolutely. Absolutely. That's what makes us come to work every day, bonding with our patients and knowing that we're making them feel better.
Yeah. Well, if you could travel time, thinking of the struggles that a med student or a resident goes through and all the crazy hours and sleepless nights, I wonder, if you could travel time and pass a message on to the younger version of yourself, what might you say to her?
I think I would say take more time out to smell the roses along the way.
Yeah.
I think I was very career focused and career driven, which is fine, but I probably should have slowed down a little. Maybe not take my family so much for granted. My family was very supportive. They were always there for me. I mean, they traveled with me to the U.S. Virgin Islands. I had 3 children with my husband, and everybody was there for me.
Pack your bags.
Exactly. And just like I'm in Kingman now, my husband is right there beside me always. But just always remember, Shirnett, they're there also. They also have needs. So I think that's what I would say to myself. And again, take care of yourself and calm down a little.
Yeah. Easier said, right?
That's right.
Well, I concede these last few questions have been a little personal, but I think I have your blessing. One more, if I may.
Sure.
Caring for cancer patients is so important, and I imagine it's very fulfilling when everything works out. In fact, you just alluded to that a moment ago, getting a call from 20 years in the past, so to speak, right? On the other hand, we know that cancer claims lives, and not every patient's going to make it, and you become a part of some very difficult stories.
Right.
Just on a personal note, how do you, as a physician or just as a human being, how do you navigate that?
Yeah. So we just have to remember life is a continuum, right? We're born, we live, we die. I find it an honor to be able to share whatever time I have with any patient and just to be part of their life, whether it is curing them from their cancer. And I'm not personally doing it. I mean, I have help, obviously.
As a team, I get it.
As a team. But also maybe it's just helping them to feel more comfortable. But also, like you said, there are the days when I'm telling a patient that I'm sorry, we can't do anything more for your cancer. You're going to die from this cancer. But the main thing is to always give people hope. I don't ever walk away from anyone not having them feel that there's some hope. So even a patient who's at the end of their life, then we're going to arrange hospice for them. We want to make sure they have dignity, right, at the end of their life. A personal story actually is one of my patients that I took care of for about 20 years. And she had about 3 cancers. I started off with 1 cancer. I actually was the one responsible for diagnosing the second one. Then she came back to me years later with a 3rd cancer. And, at the end of her life, she basically said to me, what do you think I should do now? It's everywhere. It's spread everywhere. And I said to her, and she actually said, she called me mommy. She said, you're my mommy. You've been there this whole time. And I said, I really think you've done the good fight. I think it's time to say goodbye. And it's funny. I went to her room. She was admitted. She was going home in hospice, I thought. I went to her room to say goodbye. And actually, she was actively dying when I walked into her room. And I was so honored to be there at the end of her life. I mean, I walked in the room and her partner said to me, she's going, come on in. I was able to give her a hug, kiss her, say, I love you. And then she went. And for me, that was an honor to be able to spend that time, with somebody who I had seen through so many hurts, ups and downs. And you're absolutely correct. It is it's a difficult thing, but we're all faced with it. And that's all that it is. We're all going to die, and we just have to know that we just deal with it as it comes.
Yeah, I mean, you were instrumental in her life, and you were able to share her final moments with her.
Yes.
But does that also take some reframing on your part too?
Yes,
right?
Because what it says to me is you just live life to its fullest. And that's been my motto, just to let you know, live life to its fullest, because you just don't know what's going to happen around the corner. And so I tell everyone every day, don't ever have any regrets.
That is Dr. Shirnett Williamson. She is a board-certified radiation oncologist at the W.L. Nugent Cancer Center. And Dr. Williamson, thank you so much for your time today. It's really a pleasure to talk with you.
Thank you for having me. It was my pleasure as well.
And that's the program. That's another episode of Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time.